About 8 o'clock, my computer, I call this Sawyer County Public Safety Committee meeting to order. Madam Clerk, can we have roll call, please?
Ron Buckholz.
Here.
Ed Peters,
Here.
Jason Weaver. I think we see Jason. Okay, Mark Helwig.
Yes.
Marshall Savitsky.
Here.
You have a quorum.
Okay, thank you. Pledge of allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Now, certification of compliance with open meeting law.
This
Madam
meeting,
Clerk?
this meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statute.
Okay, number 5, meeting agenda. All set. I don't have any questions with it. Does the committee have anything they want to change or add? No. All right. Number 6, public comment. At this time, members of the public will be given an opportunity to address the committee. Please adhere to the following when addressing the committee. Comments will be limited to 3 minutes or less per individual. I'm not going to read the whole thing because everybody knows it. So we have 1 for public comment. Linda Zomer.
Good morning, Linda Zoller, 902 Hollyville Lane, Berkshire, Wisconsin, Edgewater property owner. I'm going to start off with a little story before I go on with request for this committee. Last month at this time, I think it was the day after election, and someone was having a stroke at the Sand Lake Town Hall. And with regard to trying to help inform new dispatch what the address was for that, there were concerns. I heard this from 2 people who were there and witnessed it, as well as confirmation that response times to get an ambulance to the Sand Lake Town Hall, which is right next to the Stone Lake Fire Department and ambulance, it took somewhere between 40 and 45 minutes, and the ambulance had to come from Ojibwa. So what I'd like to ask this committee to do is please think about how you would like to get monthly reports to understand how ambulance service is being delivered across Sawyer County, by what are the staffing schedules for each location? What are the number of calls going from each station into which town? And then also the response times. Because when Sawyer County went to full-time ambulance service, it was based on a study and there was a recommendation on staffing. And I would hope this committee would want to understand what is the actual staffing versus what's being levied for. And again, it's outside of money, but it's actually about response time to people in our communities. That's really what it's about. It's about how are people relying on the service? Thank you.
Thank you.
I think you have one more.
Okay.
Thank you.
It's public comment. Go ahead.
Yes, it
Yes.
Good morning, everyone. Tishkiana, 16033 West 4th Street, Hayward, Wisconsin. I'm a child support attorney for the Coudray. I just came to share an update. We've talked several times, and I spoke to Andy yesterday. I think it's agenda item 12. The ongoing discussions over in MOU. I'm not sure what Andy's going to say this afternoon, but it's or later on in the agenda. But I can update you that working with the other attorney that works for the county, that back in March, we did constructively come to an agreement on the entire MOU. At that point, we were faced with a question as to a separate issue of costs related to the clerk of court. The MOU itself, if you've taken a look at it in the past or looked over it, it's concerning the County Child Support Agency, the Wisconsin Child Support Agency, Bureau of Child Support, and LCO Child Support. So that component is completed as far as the parties that concern that, to my knowledge. And then I guess we'll wait and see, but Mr. Alvarado gives his report. If you would seek any other information from me, I will be here throughout the meeting.
Good.
So, thank you, sir.
Thank you. Okay, that's no more public comment. We'll go to number 7. Approval of the previous minutes.
Make a motion to approve the minutes.
Second. Okay, we have a motion on the floor and a second to approve the public safety minutes of last month. All in favor, say aye. Aye.
Aye.
All opposed, motion carries. And then this special. Andy, what's up with this one? I guess I don't understand why we got that on there.
There was a special meeting for,
Yep,
That's Public Works though.
no, it's Public Works.
Yeah.
Oh, okay. Disregard.
okay.
Public Works agenda is not working well.
Okay, all right, thank you. Number 8, judges report. We don't have Mr. Yackel here today. Number B, courthouse remodel update, Andy.
I'll give you a kind of a brief update. There'll be a much more significant update next week to the Public Works Committee and the Finance Committee. We're working on that now. Short story here is that the court is up and running in the new courtroom. They started last week. The boardroom, well, we're still meeting in here because the boardroom, the AV is not finished yet. There's some pieces on back order to have the AV system up and running. IT is getting a kind of a temporary system put together. So that could be done here in the next week. So we can start having committee meetings and board meetings in the boardroom. There will still be some conflicts with that until the new courtroom is finished, potentially after. When they do jury trials, they need a location to have all the pool of jurors assemble. So that'll be the boardroom for the time being. And we'll end up still using this space for committee meetings as well. As far as the kind of what we're working on now to bring back to the committees and to the board is that budget wise, the contingency fund for the project is pretty well used up. We've already had some issues in the remodeling of the former courtroom for the new courtroom, where they found this additional asbestos. That essentially doubled the cost to remove the asbestos from that space. And then there are just some things that were not within the scope of the project that will need to be addressed, and we'll be talking about dollars and what things do we want to go ahead with, or does the board want to go ahead with, and how we're going to pay for those things. So putting that all together now to start running it through the Public Works Committee and the Finance Committee, and then take it to the board here in the near future. Space is working well. I think court's been running fine. All the accesses now you can get from the sheriff's department over to this building by using the corridors. I think all the offices in the sheriff's department that they're using, I have not had any, seem to be working out all as planned. So that part of it's going well. The Kansas Street parking lot and then the entrances going out to that side of the building probably won't be ready to go until middle of summer, just because everything is getting pushed back now in that world with concrete work and asphalt. Those projects are not getting started as they normally would this time of the year, so it's pushing out everybody back. So
Why is that?
yeah, I'm sorry. Yep, long winter and wet spring, and but we won't have those accesses open until the parking lot and sidewalks and everything out there is finished. So right now, the only access, or same access points off of 4th Street and Main Street get you into this building, which is the only access then into the new constructed area.
So when we come in to build, is there arrows to say boardroom?
There's lots of arrows.
Good.
Well,
Temporary
there's arrows.
Yeah. No, there's temporary signage and arrows out in the hallway.
I see. All right, any more questions for Andy? Peters, Mr. Weaver?
No questions, thank you.
Okay, all right, number 9. Clerk of Courts report, Marge.
Nothing more to add, other than there was supposed to be a jury trial that was supposed to have started on the third. Couldn't happen because of an issue with the audio video system in the third part of the new one. The attorneys were unable to play their digital video because of some missing components. So that jury trial had to be reset. I'm unsure how many more will have to be reset. If that we have it, continue to have it.
So that's putting the court system way behind it, I think.
It's not good.
No, but it is what it is.
Exactly.
Okay, any questions for Marge? Great, thanks, Marge. All right, number 10, Sheriff's Department report, Communication Center report. Who wants to give that?
I'll start with the sheriff's part. Sheriff apologizes. He's attending the sheriff's conference this week, so he couldn't make it. So basically, we have 8 full-time positions open in the sheriff's office yet. And soon to be the 9th. One of our court services officers resigned his position effective, I believe, the 17th. And he will be going to the Dunn County Sheriff's Office, so we have that posted. Good news is we've had some applicants, some accepted to move on, some didn't, so that's where we are at that. We do have one of the newly hired patrol officers in about his 3rd week of field training, so that's moving on. We are in the early planning stages for National Night Out, Cops and Bobbers event. K9 has their back to badge ball, I believe, on the 20th. So that's a big K9 fundraiser for our K9. And for anyone interested, on May 16th, Russ County is having their annual law enforcement memorial service at the park in Ladysmith. If anybody's interested, it's at 7 p.m. They'll be honoring all the fallen officers.
Hey, how are we doing on the dispatch training, chief? Are we doing okay with that or?
What do you mean that?
Well, no, we have some that you were training that were following to be dispatchers.
We do, I can let Nicole.
Oh, okay, all right.
On that, she can explain that probably. a little
Yeah,
better.
okay,
You know, they-
all right,
They
when
revamped
we
the
get
training
down there,
process a
that'll be
little
fine.
bit.
Okay. All right, any more questions for the chief? All right, number 10B, patrol report, Lieutenant Rapinski.
Thank you, Mr. Chairman. Let's see, we had another decline in our patrol call volume for April 23. And it does follow our trend we did have a little bit of a spike in March, but then it's kind of leveled out again. So we anticipate that changing and summer gears up and everybody gets the cobwebs shaken off and out to their seasonal cabins, but for this time period, we had 22 citations issued for traffic offenses, no written warnings, 11 non-traffic citations. That would include primarily our truancy officer. Those all 11 were truancy citations. School also is winding down, so we expect that to drop off as well for the year. Then community maps have been 12 total crashes, 3 with personal injuries, and no additional fatalities in our county. And I will mark that this is one of our lowest monthly totals of recent years. I don't know if we're just lucky or if it's just less travel on the roadways right now, or people are happen to be driving a little bit safer. It does bring our total crashes to date to 78 total crashes, 23 personal injuries, and 1 fatality for the year. Some general comments below. All of our 2023 squads have been delivered. 2 have entered service and 2 are still being uplifted. And our command staff recently attended the Northwest Technical College Law Enforcement Management Conference. And we also hosted a 2-day line officer leadership training, which boasted leadership from the bottom up to our line staff. And as I noted before, as we gear up for summer, we can expect to see higher call volumes.
Okay, all right. Any questions for Lieutenant Rapinski? Mr. Peters, Mr. Weaver?
No question.
Okay. All right, number C, jail report. Bennett?
Thank you. The month of April, we seen an average daily population of 72 and a half. 15 and a half of those being females, 57 males. Our average probation incarceration is 14 inmates. Average pre-sentence incarceration 48 and a quarter, and average sentence inmates is about 10. We currently have 1 on electronic monitoring. There's 14 being housed in Barron County. The day that this report was made, we had 69 inmates. We had 12 employed at the time of arrest, 57 unemployed at the time of arrest, with an inmate unemployment rate of 82.6, which seems to be a common number throughout past months.
Okay. Any questions for the lieutenant?
Yeah, is this, I haven't seen 69 in the jail. Since I don't know when. All right. It's kind of like, it's a quiet night.
Oh, we don't use that word.
Exactly. Well, it's just- Thank you for the report.
Thank you.
Okay. All right, no more questions. Number D, communication specialist report is Mr. Truck on.
I think so.
Okay. Number E, code enforcement, Brandon.
Thank you. So back in March, we had the rabies clinic, taking the assistance of Leading Edge. In total, we had 135 dog licenses sold, a total of $1,455 in sales on that. And then 176 rabies vaccine shots and 45 microchips. Grand total of sales, 3,450. And then paying for the vaccines and chips and splitting the profits as per our agreement with Leading Edge. Sawyer County made out with 1,320 in revenue from those. Grand total for revenue just from the rabies clinics, 2,775. Another thing to note, I didn't have in here, the microchips were way up. They only brought 50 and got 45. 50 was like, oh, we're never gonna get near that number.
Wow.
So happy to see people take advantage of that.
Yes.
Clinic will return next year. It gives us more time now to plan things and advertise it. And we only had about a month lead up to advertise this one, so it was a pretty good turnout for that.
Good.
Animal control, just right now, one vicious dog over at the shelter. I can't take any quarantine right now because of that dog. Until that gets resolved, any bites that someone doesn't have the dog vaccinated against rabies, they will have to seek quarantine at a vet facility. There's been an increased amount of at-large marking plates. Goes along with the weather starting to improve. Other thing I've noticed is that more and more dogs have been coming in that have to be brought over to the vet to seek care. We have the German Shepherd that had been apparently running around for weeks and his eye was a little messed up, so we had to bring him in, and then we had the blind and deaf puppy that came in that to make sure everything was good with him. License sales started to slow down with the late fees kicking in, still getting people that are late or people that forgot. And they're getting theirs now. Still working on hearing less of, oh, I didn't know that I had to get a license. And then the final note there, we were going to get a canine kennel for my squad that was canceled because it was too much money to install. So I'm once again without a barrier and have been told by Gen Com for I think the 4th or 5th time that it's going to be here in about a month. So we'll find out next month. On the public health and zoning, nothing big there. More complaints have started to come in as the temperatures start going up and all the snow is gone. People start seeing all the trash that's been dumped around.
Okay. Is there anything out there that you can tell the committee or whatever? Is there any like spare neutering help out there for people that can't afford to have it done but want it done? Is there any programs out there?
Nothing that I'm directly aware of. I think that the Humane Society would likely have some resources. I know for feral cats, working with the Humane Society, you can get them trapped and then get the feral cats, their rabies vaccinations and fixed and marked.
Okay.
But other than that, I don't have anything.
Okay. I know somebody often asks me, and I did mention the Humane Society is a place to check, but I thought maybe you had some info on some other stuff. Okay. All right, any more questions for Brandon? Mr. Peters, Mr. Weaver, none?
None here.
Okay, all right, thank you. Number 11, emergency management. Nicole, I guess you're up now.
Thank you. So in April, I attended the regional meeting down in Spooner. We discussed flood outlooks for the National Weather Service. They were there. Shortly after that, I was contacted by several of the area dams and National Weather Service. Basically alerting me that the dams were gonna fill up quick and to expect a lot of water rushing down. That did occur in the Winter Dam Road area. Also on the Flambeau side, however, that didn't really impact Sawyer County, thankfully. We did declare a disaster, Sawyer County did, due to the extensive snow melt and the potential for the heavy rainfall. There were several townships, including Radisson, Winter, and I forgot to add Draper, that had significant water, culvert washout and road washouts. I think Draper still has some roads closed. Radisson's all open back up. Barker Lake was underwater for a while. Still in communications with the townships regarding those damages. Getting costs and all that stuff evaluated. We had an LEPC meeting on April 19th and discussed the EOP plans as well as other hazmat related discussion regarding what equipment is on hand in the event we have a situation regarding that. And as Chief mentioned, we do have national night out plans. We had our first meeting on the 28th of April. In reference to your question about training for the communications center, we have one employee who is wrapping up their training, should be done in the next week or so.
Okay.
Another one just started. We also offered 3 part-time positions to stagger out training for another 3 additional dispatchers to hopefully in the near future fill the vacancies that we currently have full-time.
Okay, I should have read farther because I see it in your report now. Sorry about that.
That's all right.
So. Is that all you have, man?
I have a few other things for the communications reports. We are looking at upgrading our radio consoles and dispatch. We have quotes, we're seeking quotes at this time due to the consoles approaching their end of life and updating capabilities. Lumen or CenturyLink is exiting the 911 system. They're no longer going to provide services after, I believe, August. We're looking at other companies to provide our 911 services, and we did sign a participation agreement to begin working with the state with EZNet of Next Gen 911, which is an internet-based service for emergency 911 system.
Okay, good. Any questions?
I do.
Go ahead.
Did I read somewhere that there was a flyover of some areas with the drones?
Correct. Before the flooding season really took off, myself and another deputy took the drone over the potential areas for flooding that we had meetings about, which was Smith Creek and Dam Road areas. We did take before photos of those. Have not been able to take after photos yet. However, Smith Creek did not ever reach really capacity for flooding, so we got lucky.
Okay, that's what I'm concerned with. It's written on my house.
Yeah, we were monitoring it very closely.
Good, thank you.
Okay. Any questions, Mr. Peters or Mr. Weaver?
No questions. Thank you for an update, especially on the townships.
Yep. Okay, thank you, Nicole. Good report.
Chair.
Yes.
If I could just kind of pull in a couple things here, going back actually to the courthouse remodel, with the opening of the new construction and getting that up and operating, we did have a meeting with staff within the last month, including the sheriff's department, court security, court staff, just to talk about safety, security type issues. Just the basic things like there's badge access to a number of the secure doors, who has access, and getting those things settled. One of the, I want to share this because I think it'll probably come up down the road sooner or later. One of the concerns raised by court security is that now their offices used to be located here by the old courtroom. Now they're located on essentially in the sheriff's department. So it increases their ability to get to anything that happens on the south end of the building. So we did have some conversation about courthouse accesses and in the future what we might be looking like or considering. And I know the judge has talked to me a couple times, most recently as of yesterday, talking about additional courthouse security and securing the building a little bit better than we do now. So just wanted to share that that conversation's ongoing.
You said with them over there, it increases their ability.
Yeah, I mean, I would say doubles the amount of time it would take to get to something that happens at the,
It increases the response time.
yeah,
Okay,
that's what,
thank you
Okay.
for that.
Essentially, there's more doors to get through.
yeah,
That's what
I missed a word that's kind of important there.
yeah, because I was thinking over there, how can it increase their? Thank you.
Yep.
All right, all right, go ahead.
This upcoming year is when the next court security spot's gonna open up, right? We're gonna have two of them now, or just one still? Cause we're gonna have two courtrooms, right?
That is a conversation that has not happened.
Hmm.
I
Like
mean,
a
as
recorder?
to be perfectly frank, when I started, the story was that there was gonna be no increase for staff with the second courtroom. Doubted that. But kind of all those conversations are pending the second judge actually being started. So I mean, can the existing amount of court security cover two courtrooms? Really has not been flushed out, just like judicial assistant. Are we gonna need additional time there? Is that fair? Nicole, I don't know, look
Yeah.
at you.
I would agree. I mean, we can cover one court room.
I like the look on your face when he's asked that question, because it was like, yeah.
We have the ability to cover the courtroom we have.
Right.
But our court services right now is a Huber deputy, a court security and court services. We all pitch in really well together to work together to make everything secure around here. But when it comes to securing two courtrooms, you have a court services officer who's maintaining the jail side of court. And our Huber officer who's doing all those things as well. And then you have one court security who's supposed to maintain control over two courtrooms at one time.
Those two people you're talking about, they're really maintaining the inmates, giving them two court.
Correct, and all the paperwork and all the these things that go with that. It's not to say that they wouldn't be able to respond, however, they're tied up with other things that involve the court system.
So no court reporter, no JA and no court security?
Court recorder at least is the state position.
Oh, it is?
Yep, and we do have DARs now, so there's not always a need for actual stenographer to be there. But I mean, I'll share my conversation with the judge months ago was that he was not going to bring any of this up until there was a second judge to have the discussion with as well. But I mean,
That's not the.
well, and he can give you his reasons for that. But there's also the kind of the conversation that, yeah, we have two courtrooms, but we don't have twice the amount of court cases necessarily. So it's how is court going to be scheduled? Who's doing what? But I mean, listening to court security and the judge, I mean, our civil cases have just as much security needs or security issues as criminal cases, sometimes even more. So, but we're and we're looking at Nicole, and unfortunately, like we made Nicole emergency management dispatch, but she's still kind of the point person on court security at this point. So I mean, I know she has her thoughts on this too. So, and she's here in the meeting, so we can look at her and ask these questions.
Yeah, I remember when Andy too, when they said that this new courtroom wouldn't have
Yeah.
extra
I was like,
staff.
yeah, okay.
But it's something that we're gonna have to be able to take a look at because, just listening and. I don't know how you're gonna handle all that.
I don't have a good
It's
answer.
really gotta be looked at.
It's
That
gotta be looked at.
conversation be had here soon, or before budget, I'm guessing.
I'm sure it'll be a part of the budget for next year. But we're not the only thing we included in this year's budget is we increased some custodial time by half a position to account for the additional. And when you look at the new space, there's definitely a lot of floor space to clean,
Right.
so. Again, I'll just drop in this, though, the other thing with a couple of things that are happening is we're watching the state budget. You know, it's probably good that we're on the slow track because it's. Depending on which budget goes ahead and how that plays out, there is talk of additional money in there for 911 services as well as law enforcement. So potentially, but it might not be retroactive to like your existing staffing. It's potentially money targeted towards new staffing, which could be applied in this case too. And EMS, there's provisions in both budgets for additional ambulance staff or ambulance funding. So if that makes it through the budget process, then there might be some relief for us there, be able to add the staff.
Okay. All right. Any more questions? Well, I'd like to thank Nicole and the Sheriff, or Sawyer County Sheriff's Department for all they do and being shorthanded and keeping the public safe. Thank you. All right, number 12, child support MOU. Discussion and possible action. Okay, where are we with this again?
I actually think Tish's summary was fairly accurate, that all the essential components of the MOU were settled a few months ago. The attorneys, Tish and our attorney addressing this, have had limited conversations. And the last remaining piece is the charges for transfer of files that the clerk of court will charge. I didn't realize it's in the agreement now, or we want an agreement. We're talking now about taking it out of the agreement, and making that a separate agreement or separate, whether it's an agreement or understanding between the clerk of court and LCO. So that needs to happen. I think we need to get together with Marge and LCO and figure that out, and then we can bring it all back and get that.
I want to get it out to us so we can take a peek.
Yeah, well, that's why I didn't know I was having the conversation with Tish yesterday. Maybe we could have put it out, that the agreement without the that piece in there. But I just didn't. I think yesterday's conversation and the one since then have moved us a little further along now to get it done.
Yeah, I don't think we should.
No, you haven't. In the meantime, I mean, we're essentially operating under the MOU now, and there are some cases moving between us and LCO.
Okay, so we're gonna postpone it until next month.
Yep.
Okay. All right. Any questions, anybody on that? Right, number 13, emergency services, ambulance report. From you up?
I'm up. As you can see, we had 135 runs in April. It's up from last year, 120. We're kind of working on the transfers, I'm working with Hayward Hospital. We're actually gonna be revamping our billing contracts to kind of more suit them as far as return homes to Aspen Acres, so it's a more guaranteed pay than some of this Medicare, Medicaid stuff that we're doing, especially when they're having, people that are under assistance. It's kind of hard to get people to take them back to like Aspen Acres and everything. So we're working with LifeQuest and Hayward Hospital's billing department on that. You can see that we've had 124 of those were just 911 only runs, which it is up, but not, nothing crazy that we can't handle. We got some new hires coming in. We got a guy from Solon Springs that comes, Eric Chandler. We also got a RN plus, and she's an advanced and an RN that's going to be working with us to help us with transfers and 911 calls. And also our old coroner has decided to join back up with me and take some transfers if they come out, Dave Dockersell. So we got all them guys back, and we're working on getting them through our training process and making sure that they're all up to date with all the new organization and getting on the new schedule and learning how to clock in correctly. We're still a clinical site for Northwest Tech and CBTC and all the other places. We're highly sought after. A lot of people like to train underneath our people. I have a lot of instructors that are both with Northwest Tech and CBTC.
A lot of my instructors are now becoming higher level instructors. So we can do almost all our in-house training. I don't have to send people out and spend a lot of money on keeping their licenses up, so we can do all that in-house. We got our new ambulance and our new Striker load system that's been in use. We used the Flex grant for both of those things, and it's been wonderful to have another ambulance, because some of these ambulances just needed to get down, get their, brakes and stuff done. So all the maintenance now, that takes the load off of them. I ordered a pretty expensive mannequin that's to help us with our codes and strokes. It can mimic all these kind of things. We can intubate them, we can give them shots. It'll do heart rates and fetal pulses, the whole 9 yards. So another thing, because like I said, if my guys aren't busy, we can always be training.
Yeah.
So that's a huge thing for me. We have EMS week coming up in May. That's a kind of a big thing with EMS. We're doing a picnic. I believe on the Wednesday of that week, of the 21st to 27th. So we're gonna be holding that for EMS staff or whoever decides to come through. So, just gonna stop by. It's kind of a big deal for us EMS people. When we come to the billing stuff, you can kind of look, it looks like almost we've collected almost exactly as we did last year. The difference is that we've collected the same amount of money on a lot less calls. So our billing company is kind of working, we're actually collecting more money than we did last year with the old billing company. And you can see I got the percentages down there, right there. So far to when I printed this report, which was I believe 2 weeks ago, I've spent $33,861, which is 17% of the budget. However, almost 10 grand of that come from grants. So any questions on that?
Yeah.
Yeah.
The other day, I had a stop at Exland. And I was approached by a citizen that they made an ambulance call to the village of Exland back in March. They told me that when the ambulance got there, they wanted the patient, the people did transferred to Rice Lake.
Okay.
The people on the ambulance said they couldn't transfer them to Rice Lake. The only place they could take them to was Ladysmith. They didn't want them to go to Ladysmith. If they had to go to Rice Lake, then they had to take them themselves. And they asked, well, why is that? They said there was no other ambulance in Sawyer County that day. They were out on transfers.
Well,
And if we're doing that, that's not right.
well, if you look at our transfer, we don't have many transfers, and we don't use the on-call crews for transfers anymore. So there's always 2 ambulances.
Well, why would that crew tell these people that? And they ended up transferring themselves.
Yeah, if they did that, and if I find out who the crew is, I can address it, because.
Well, I don't want to
it's not-
give you any name, but I would
Yeah.
after the meeting because,
You know,
and then the complaint was they turned around and they got a bill for $400.
so I've actually been addressing this, we've always done that, if ambulance makes contact with people, right? You're gonna get a bill. It's just the way it is. It used to be back in the day that it was EMS discretion on whether you got it, and now when I say back in the day, this is like Brian Cody, older
Yeah.
area. What ended up happening, I believe, is that we were getting a few residents that were kind of using the ambulance as a care facility, where we were getting multiple calls for the same kind of thing, and they actually needed to be in a nursing home. And I believe it was this committee and under Mitch Rice where they said, no, then everybody just gets a bill. So that's what we've been following. I did bring this up with Andy. We were talking about it on whether we should address this again. Because, even to me, that does seem expensive, but we also
Right.
can't pick and choose what citizen gets a bill and what citizen doesn't.
Well, I think we should take another look
Yeah.
at this, because if that ambulance was called to that scene and they did not transport.
Yeah.
That's not right to bill a person for that.
And
It's just, it's not right. And the next thing I wanna say about it is they left messages on your answering machine and nobody ever got back to them.
I've answered all my messages, so I don't. I don't. Yeah, if they did, then I don't know, because I got like 4 phones that come to my one phone. And there's one that still has Nate's name, I haven't figured out how to
Yeah,
get out of it.
they said that was the one that
Yeah.
had Nate's name on it.
Yeah, there's one, because right now I'm trying to get my corner line, which I still kind of use. And integrate it into the ambulance line. So because I still get really important calls on both. So. But anytime somebody calls me and if they leave a message, I usually call them back.
Well, that's what
Right
they
away.
told me, so,
So- And if they didn't, if I didn't, I apologize. I don't
yeah.
remember. And my door, anytime I'm there, my door's always open. The only other thing is that I've been taking shifts too. You know, like on weekends and stuff to help ease the load, because we're kind of low on some paramedics.
Right.
So if they're calling Monday through Friday and I'm not there like Wednesday, Thursday, Friday, it might, I might come back to work on a Monday with like 14 messages. So, and like I said, if I missed it, I'm sorry. I know, like I said, I actually wrote Andy an email addressing we should probably revisit the $400 thing.
Well, we
Again.
need
Yeah.
to take a look at that again.
So, and the only thing that I wanna slow down is like, because we can't just pick and choose who
Right,
gets.
and I
because
understand that.
If I get to a scene where we believe that they should go, and that's kind of a problem, like you'll get people that they just want us to help them up, but this is our time, we're looking at someone. And they're really sick and you're like, no, you please go, we're trying as hard as we can to get them to go, but they still don't want to go. I believe that my EMTs that are doing all this work to try to, they're trying to assess them, they're trying to prove to this person that, hey, you are sick enough, you need to go to the hospital. They can spend a lot of time there with that patient. So there's.
Yeah, I understand that part, and.
So I guess we would have to actually draw up a resolution of what criteria meets
Right.
what.
Yeah. I mean, I told him I would ask about it, and find out.
Which I'm fine, because like $400 to me is really expensive, so.
Yeah, well, that's what they told me. They got a $400 bill and nobody did nothing, they didn't transport it. What do you got to say, Mark?
The issue with them not getting transported to Rice Lake. I guess what fell through there,
Yeah,
that's my,
well, that
beat that thing with that $400 billing, if they go out. The ambulance system's gotta get paid somehow. If they leave the garage, there's gotta be charge.
Yeah, but I disagree with that, Mark, because you know why I disagree with that? Because these ambulances, they go out, they take that ambulance to the restaurant. Who's paying for that?
I know.
Tax dollars.
I have issues.
So,
I agree with you on that, so.
I mean, that's fine. I don't care where.
But
they
what I'm
want.
saying,
Right, I understand what you're saying.
if they made contact with somebody out there. They've gone to a scene,
But they didn't do nothing.
but well,
okay,
then,
then the issue then, like I say, is. What happens or is, I don't like that, well, you gotta take them then.
well, that is an employee thing. That's an issue that I have to address with
Yeah.
whoever that did.
Right.
That's not a standard practice.
So your policy would be.
No, my
Take
policy,
them to Rice Lake?
yeah, my policy is to take them to Rice Lake. There's only one little caveat on it, and it's, how sick are they? So if they're in need of immediate attention, like, then they need to go to the closest facility, right? And that's just statewide, that's how it is. If they're stable, like sick that they need to go to the hospital, but they're stable enough for a transport like that, and of course, obviously, if he goes into a car and they transport him to Rice Lake, obviously, he's stable enough to do that.
Okay, my next question would be then, say if Ladysmith would be the closer place and they want to go to Rice Lake because they want to go to Rice Lake?
Yep.
You know what I'm saying? It's kind of like,
But
I want to get surgery, but it's not really required.
so here, if the way it works on kind of that level is because Ladysmith and Rice Lake are in the same,
Yeah.
they're the same thing. They're Marshfield Clinic, right?
Yeah.
And what ends up happening with that is like, we will get calls from the receiving facility asking, why did we go to Rice Lake when their needs could have been filled? Because, I mean, they don't care what the patient says, hey, I told the ambulance service I want to go to Rice Lake.
Right.
The hospital calls us and says, hey, their needs would have been met at Marshfield Clinic. You can't say that we went to Rice Lake to get them out of the different, like, because they were a Mayo patient. Because,
Yeah.
that would
But you
be,
know what I'm saying? Because the people on the ground there, mommy and daddy say, I want them to go to Rice Lake.
so
But yet Ladysmith is might be the better location or the closer location. Just asking.
the correct conversation that my crew has to have with them is that because that's not considered the closest, and this all has to do with billing and everything. Every mile that's farther than Ladysmith is the patient's responsibility, not the insurance. So if they want to go to Rice Lake, they just got to be informed that they're gonna probably have a $1,000 bill that they have to pay because it's the mileage difference between Ladysmith and Rice Lake. And that's what billing looks at. That's how they do that, and that's how their insurance, depending on your, if you have awesome insurance, I mean, then who cares? But if you have like Medicare, Medicaid, they're not gonna pay that mileage difference. So if you're like 10 miles from Ladysmith, but 50 miles from Rice Lake, I mean, it's $24 a mile.
Okay, so those EMTs or whatever on the ground should have told them that.
Yep.
Instead of saying, no, we just can't take you.
Yeah, well, they've been trained by me personally to be, that's how they're supposed to have that conversation. So I will definitely be looking into this and having conversations with
So
you.
they should have a better response. than
Well, Rob, I'll give you the person's name
Okay.
that talked to me, and I
After
would
the
like
meeting?
you to call her. talk to her.
Yes, I would love,
Because it was just disturbing to me what she was telling me.
and, I'm not gonna doubt that my EMT said that,
Yeah.
but I'm not also, I can't take everything because I
No,
hear,
no, and I understand that.
I get blamed for things all the time. I mean, I am married, so.
Yeah.
But I do, because one of my biggest things, and it's kind of a thing that I'm kind of working on, like, because we're starting the EMR programs. And I'm trying to, if you guys can push your fire departments to get people to sign up for them. The EMR programs, that because I like the whole volunteer aspects of, and having those people upcoming. But it's the community support that we need more than anything else.
What's the amount?
EMR, emergency medical responders, it's basically the first part of becoming an EMT. And both myself and Round Lake Fire, we got a grant to help pay for some of those classes. So we're working with the fire association, trying people to get signed up before them and stuff. Plus, we have the high schools, the LCO high school and the Hayward High School. They're gonna try to offer some EMR classes in the high school. And then we also got the LCO College that we're working with, and they're looking at starting an EMT basic course in Sawyer County. So, because I love volunteers, I used to volunteer forever, I still do a lot of volunteer work. And I believe that we can still have a full-time ambulance company, but also have the support with you know, it's,
Community.
you know, it's perfect. It's perfect for people who are retired EMS. They can come in, do some work. They can fill in shifts when available. They can answer calls in their area. So that's my whole, that's what I'm trying to get to in the end here.
Well, I think we got a great
But-
ambulance service
Yeah,
here in
so-
Boyer County, but
Just
you
get
know,
that
when
one
you
on the
got
sheet.
somebody coming
Yeah.
up and
Well,
telling me this
Yeah,
stuff, you
well,
know? And I being a county board representative, and I represent that district, and I'm also sitting on this committee. I told her I would address it today, so.
And I will definitely, if I find out who, I want to get to know exactly what happened. Because, you know, obviously there's 3 people on the call, so I can talk
Right.
to all 3 and say,
Okay, Andy?
I was gonna suggest, John can follow up on what happened on that call with you and maybe come back with some. Little, you know, some more explanation on the policy of how patients are transported and where, because there are always other little things that come up, you know, for hospitals on. Not so much now, but a couple years ago, hospitals were on divert. Well, you had to
Yeah.
go, you couldn't go where the patient wanted because they're not, may accept them. The other thing though is the $400 charge has come up in some other, I guess complaints or discussions. And I guess John and I can talk more about that, but he can come back and explain. I mean, generally, the kind of the rule of thumb, and it's not a technical term, but you know, my familiarity with ambulance services, if they put their hands on the patient, there's a run sheet that gets sent to the billing company, the billing company bills it out, even if there's no transport. But like John said, I know most ambulance services have that because you have people that just need a lift assist. They call an ambulance for that, or they need a glucagon shot, and then the ambulance leaves them there. So probably part of the discussion is what's the technical, what has to happen for a bill sheet or run sheet to be created to go out, and then, you know, do we give like John the discretion, because it's really hard to reverse a run sheet, like once the bill's gone out, I mean, but can John, or do we give them discretion to intercept them? Not take the run sheet and send it to the billing company? And under what terms do they have that discretion to do it?
and since we started the new billing company. That before it actually does go to billing now, it gets run, it gets sent, and then we send it. So we do get that, but I would have to know what call, because I'm looking at like 30, 40 calls at a
But
time.
you have the opportunity to nip it in the bud.
Yeah, we can, or I can address it with even have the billing company code something.
Right.
Where if it's this, you know, the only thing I say is like every ambulance in the state, you know, whether it's a volunteer ambulance or full-time, they do charge, and it's the same charge. So,
Okay, I want to address the issue that was brought up during the public comment as far as that Stone Lake issue. Why did it take so long, and why didn't the Stone Lake people take care of it? Well, why was it so hard to find the Sand Lake town building? And there's a lot of questions that happened.
so you would have to know how the day was. Was there 3, 4 calls that day? Were they tied up on other calls? I can't force people to become volunteers for the Stone Lake ambulance, you know, I mean, our one person that would run a lot, unfortunately, is passed away. And
Stone Lake is not a full-time.
no, they're a volunteer. Well, I call them volunteer, but they're called part-time stations. There's the Ojibwa station and the Hayward station are full-time. Monday through Friday, or Monday through Saturday, there's 2 crews on till 9 o'clock at night. Ojibwa's 24 hours a day, 7 days a week. Hayward out is 24 hours a day, 7 days a week with 1 crew, but the second crew is 9 in the morning till 9 at night. That was first put on there for transfers. But the problem is that we're so busy with 911s, you know, it's almost, you're risking sending them out on a transfer because you'll have 2, 3 calls in a row.
Okay, well, so there's like Stone Lake, like Bass Lake, and there's some other,
Stone Lake and Round Lake.
okay, well, those are.
They're like on call.
Yeah, on calls.
There's nobody there.
No,
No, and they might not be there might not be anybody available for a call. If they're available for call, they get called in for runs. So like, would you guess Round Lake and Stone Lake, how often are they?
they're also Round Lake gets a lot more calls than Stone Lake.
They're up and available more often.
No, they're all retired, right? They'll be now this summer, but usually during the winter and time, because a lot of those EMTs are snowbirds. So they're down in Arizona or wherever they're, now I'm getting them back. I got a couple more, so Round Lake crews usually get more people. Stone Lake, like, that's why I'm working on the EMR stuff, is I need some people in that area to respond. There's a rig down there.
So we don't have the people to man them.
No.
Around Laker, so like that.
No, not, like, it's, you just kind of picture it like when we used to be all volunteer, everybody was volunteer.
Yeah.
That's kind of how we left those two, but there's always a full-time in Hayward, always one in Ojibwa. So if there's a page and there, even if it's in Stone Lake, Round Lake, if there's nobody out on any other calls, the closest crew ends up running out there, either way, either direction. So there's always someone supposed to be going to it, but if there's, 2-3 calls going on. And we actually limited the transfers because our call volume is just too high to guarantee sending a crew out on a transfer. So we only try to use like these nurses and stuff.
So there was only one crew on 24/7 in Hayward and Ojibwa.
Yep,
One in each spot.
one each, yeah. So 2 full-time crews with the county.
Okay,
So-
let's get rolling.
Yeah,
on it.
let's keep going. Don't like what you're doing.
All right, thanks, John, for that. Anyway, all right, number B, Town of Edgewater requests discussion and possible action item.
It's a carryover to John and I have not been able to coordinate. To get together with Edgewater yet.
All right. All right, number C, ambulance financials. Could you kind of give us a little bit of update in on that, John? Is there any more you want to add or?
The only other thing that I can tell you is that this year, the Flex grant, we should be getting some more money out of the state grant on that. Billing is, I've been working with Mike Margren, making sure that our financials and everything are within line. So, and everything, what we've last talked about with me and him, everything is going pretty good. They're doing an audit right now on going through all the numbers and stuff in his department. So I haven't had any major updates besides what I put in here.
Okay,
So
all right. Number D, medical examiner's report.
all right, well, as you can see, I have 2 people that wanna work as coroners or medical examiners. I don't hire people unless they're already certified. So they're right now in EMBDI courses, which is basically, it's college for coroners. They start in May and it should be done somewhere in July. So it's run by the guy who does the body farm. So, yeah, so it's a very in-depth course. I just had 2 of my what?
How do they do that?
Yeah, well, and then yesterday, and this wasn't in here because this happened yesterday. Yesterday, the Dane County Medical Examiners, they held a class up in Shell Lake, and 2 of my medical examiners, Aubrey and Rion, went to that, and it was for child death investigations. Homicide, suicide, homicide, suicide, and natural deaths, SIDS deaths. So they covered all that. And as you can see, that's our breakdown. We've had 26 investigations. I've done 24 cremations this month. And you can see how we do that. We have 10 pending. We're just waiting on toxicology and autopsy reports.
Okay, all right. Any questions for Mr. Fremmel?
No, sir.
Peters? Okay,
No,
thank you.
no, sir.
All right. Number 14, Criminal Justice Coordinating Council update.
Yeah, the primary things there, I've just been talking with, working with Justice Point, having them report out to the community regarding the treatment and diversion court progress. So the treatment court is getting closer to be up and running. The treatment court team went to the state conference last week. That's part of their training. Again, that's still being timed to when the second judge will be on board. There's just not judicial capacity to get the treatment court completely up and running until then. A diversion program is they appear to be somewhat successful. There's 12 cases currently in diversion. They've graduated 17, and then they have another 8 that are awaiting intakes. That's as of the end of March. That's the first quarter report. So we just submitted that to the state. And they work closely with the DA and judge. The DA's office gives them a list of low-risk offenders who are suitable for diversion. And then they work with the judge on the bond that the person's going to be on so that they can put them into the diversion program, which means ultimately they hopefully don't spend much time in jail then and don't clog up the court system as well. So that's I guess that would be the primary thing that we've been talking about in CJCC.
Any questions for Randy? Okay,
No questions.
all right. Thank you. Number 15, future agenda items. Okay. Number 16, correspondence reports from conferences and meetings. None. Okay, thank you, everybody. We are adjourned.
Thank you.
Thank you, guys.